Here we go. Circular, convergent, fusiform, parallel, pennant again, because of all those things. Determining function. Kathy, why am I staring at your ceiling fan? What is happening? Levers. No, don't really care about this in terms of what I need you to know for class, but do care about the examples of first class lever, second and third class levers. Know those examples. And then we went into naming. Oh, and we stopped there. So we did the face, the head, skull, I'm sorry, and the face, the facial muscles. We did the neck, back, remember spinous. Let me go to that slide. If you see the word longissimus iliocostalis or spinalis, you should be thinking spine all the way along those spines there. We skipped this slide. We have the external intercostal and internal intercostal, and they actually overlap each other. If you merge those two pictures together, that's what they look like. And the diaphragm is really important. Is it so important that you know the foramens for the diaphragm? Meh, you should know what goes through the diaphragm, your aorta and your inferior vena cava and the esophagus and the spine. So yes, I guess it is very important. You should know that. Okay. So then we got to abdominal wall. Right, I have too many screens open and you're going to annoy me, aren't you? And then you went there, didn't you? You know what? I win. Let's try it a third time. There we go. Movement of the abdominal wall. Wally. Hide. You got 4 pairs of muscles. Their fascia and the aponeurosis form lateral and anterior abdominal wall. Form the lateral and anterior abdominal wall. What is lateral? What does that mean?
To the side.
Yes. And anterior is?
The front.
The front. Do we say front? What do we say?
Ventral.
We say front. We also say ventral, but what are we really talking about?
Belly side.
The belly side. Very good, right? And then dorsal and posterior is the spinal side. Okay. You got your rectus abdominis. What does rectus mean? Ooh.
The butt. The
butt? No, that's hilarious. I love it. No, it's a directional term that is what rectus means.
Straight up and down.
Straight up and down, straight, straightness. Yes. Then what do we got? Obliques. What does oblique mean?
They're slanted to the sides.
They're slanted to the sides. And what does transverse mean?
They go across the body.
Okay, good. You've just named the abdominal muscles. Rectus abdominis is where you form your 6-pack. Your external and internal obliques are what allow you to twist, like you're doing the twist. Let's do the twist. And I'm sure the transverse abdominis says something very important. I should know it. Fascicles run at angles to one another to provide strength. They're all innervated by intercostal nerves. It allows for lateral flexion. So, you know, squeezing those, like if you brought your elbow to your hip, you squeeze the side, and rotation of the trunk. And they help promote urination, defecation, childbirth, vomiting, coughing, and screaming. Also projecting your voice when you're yelling or singing. That happens in the abdominal muscles too. Or playing an instrument if you need to go forte or mezzo forte or whatever all the fortes are. So here we go. You got your rectus abdominis, your transverse. Okay, so first, rectus is straight up and down. You see this, right? And this is where you form the 6-pack if you have one. So 1, 2, 3, you can even form an 8-pack, but that's typically harder to do. And then 1, 2, 3 there. So 6-pack, and then you go cut a layer away, cut through the rectus abdominis, and you have your internal obliques. Whoa. External obliques, then rectus abdominis and internal obliques, then cut those all away. and you have your transverse abdominis. And please note that all the tissue arrangements are opposite each other, or they're different to each other, straight, sideways one way, sideways the other ways, and then all the way across. And that provides tensile strength, which means it should be very, very, very difficult to possibly rip through those layers of muscle. Not impossible. Disemboweling is a favorite form of killing among animals when they're trying to catch prey. It's what bears do and mountain lions, and I'm sure lions and tigers and bears. Oh, I already said bears. So it's also the least protected part of you, but it is multiple layers thick of different, not patterned, but different structured muscular tissue to make it harder to get through. Then you have those aponeuroses, which are sheets of connective tissue. And so this whole thing is an aponeurosis. If it wasn't cut away at all, you see aponeurosis of the external oblique. And then you should have one of the internal regions as well. When you form that six pack, the thing that's cut into to make the distinction between one piece of muscle and the other is called a tendinous intersection. And right down the middle of your body, right at the midline through the umbilical cord, or the umbilicus, sorry, is the linea alba. So there you go. Very important things of the abdomen. They also want to show you the pectoralis major up here, but that is not so much an abdominal muscle but a chest muscle, and the serratus anterior, which is part of your rib cage up in the thorax as well. You have an inguinal ligament, Lord help me, inguinal ligament, which is formed by the aponeuroses borders here and here. You ever pull your groin? You're stretching the ligaments here, or down more in the pelvic region. You're also stretching muscle and tissue too, but don't pull your groin. External obliques, this is obviously the side view of everything, is the outermost layer with that aponeuroses. Then you have, cut that away, you have the rectus abdominis, and then the internal obliques. Cut those away, and you have the transverse abdominis. Once again, I know I've already said it twice, but straight across, parallel, I guess, oblique in one direction that is opposite of the oblique of the other direction, and then straight up and down. And the whole reason the body did this in 3 different levels of different directions of tissue is to make it harder to shear or tear and harder to get through as well. This is if we were to cut you through the transverse lines, and you can see the layer here. This is kind of a pointless slide, but okay. Pelvic floor. Who has ever heard of Kegel exercises?
They were all the rage on TikTok during the summer.
Were they?
Yes.
Around doing nothing, so you might as well exercise your Kegels, huh?
Mm-hmm.
And what do Kegels exercise? Let me get the grammar right.
Muscles inside the vagina.
Well, it's not just a female exercise, but it is the muscles of the pelvic floor. Men can do Kegels too. And if you think about the different things that we do with the human body, like if you have to pee really bad, but you're holding it and you tense that area, that is part pelvic. Or if you're trying not to go and defecate, like if you wait until you get to the bathroom and you tense back in the anus region, you're also tensing part of the pelvic floor. But you have to be able to isolate the very bottom. It's like a sling. They literally are like a sling of muscles between the urethra and the anus. And when you tense them, you tense the entire bottom, but you're not squeezing your butt and you're not squeezing your thighs. You're just squeezing the muscles kind of around that area. If you do it correctly, it's a Kegel. It is very important that you have a strong pelvic floor, ladies and men, but ladies specifically, because all those things you hear about childbirth, not able to hold your urine afterwards, peeing when you're sneezing or laughing, a lot of the complications of childbirth happen because of a weak pelvic floor. So Kegels are a thing. Y'all should look them up. The pelvic diaphragm is composed of two pairs of muscles, levator ani and coccygeus, excuse me. These, unlike the abdominal muscles that were innervated by intercostal nerves, these are innervated by the sacral nerve. So they're coming through that those sacral foramen in the sacrum. Do you remember how the sacrum had like 8 holes down it in the foramen? Functions of the pelvic diaphragm: seals inferior outlet of the pelvis. So it closes off the bottom of you. That's nice. Supports pelvic organs, which would be the bladder, the vagina, the uterus, the testes, the rectum. Lifts pelvic floor to help release feces and resists increased intra-abdominal pressure. So, for example, those last two kind of go together. If you've ever been constipated and you're trying to release feces, you're bearing down is what it's called, but you're like trying to force the feces out. That increases intra-abdominal pressure. If we didn't have the pelvic diaphragm, the bottom part of you could just split open. That'd be awkward. So we have this pelvic diaphragm to help with that. So here's what the pelvic diaphragm looks like. It is a lot of different muscles. And they're all kind of holding you together. So we're back here. Here's the spine, right? And here is the interior. There's that pubic symphysis, which allows a little bit of flexibility between the pubic bones. And then here is your pubis, I guess, pelvic floor. Let's do that. So the two main ones are the levator ani, here and here, and then the coccygeus, so here and here. So those are your two main ones. Here is another levator ani. No, it's the same one. I'm not crazy. Thank you. Urogenital okay, so the opening for the urethra, the opening for the vagina, the opening for the anus as well. All of that is here. So when you are doing a Kegel exercise, you're very much squeezing the levator ani and this urogenital diaphragm. It's all these muscles right here. Then you have others, piriformis. Ooh, piriformis, that's also a nerve, by the way. You know that you have the sciatic nerve that runs through the hip down the leg. You probably don't know that yet. When y'all get about 10 years older, you're gonna learn about the sciatic nerve and how it sucks. But you also have the piriformis muscle and nerve that you can also pinch and squeeze with the hip as well. And that's it. So your two big ones though are the ones in bold, levator ani, that ring all your openings, and then the coccygeus that are to the side there. So pelvic floor. Thank your pelvic floor that you haven't split into. Blah, 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 blah. Do I care? I guess I care. Anterior half of the perineum. What is the perineum? Or perineum?
It's the soft tissue below the vagina.
Okay, so below the vagina and before the what?
Before the anus?
Yes, very good. And for males, it's behind the scrotum and before the anus. So it's inferior to that pelvic floor we just looked at. It's deep transverse muscle, and it contains that external urethral sphincter. Your urethra and your anus both have two sphincters. One you have no control over, and then the final one is a external sphincter, and those are the ones you squeeze when you're trying to hold urine and feces. So I'm probably not going to test you on these. Maybe the sphincter. The sphincter is pretty important. So you have an external urethral sphincter and an external anal sphincter, and those are the ones that you can squeeze. Those are the ones that babies, children have to learn how to control as they're being potty trained, are those external sphincters. But the point of this PowerPoint is that the deep transverse perineal muscle is in between the urethral and anal openings, or the vaginal and anal openings of females. These are going to be kind of like possibly extra credit questions, especially this one. Star that first bulletin point. Muscles of the superficial perineal space, your ischiocavernosus, it's like a Harry Potter spell, and your bulbal spongiosus help maintain erection of the penis and clitoris. Remember that both the penis and clitoris are derived from the same tissue layer in utero as the fetus is being formed. So they both are filled with spongy tissue that engorges with blood during sexual excitation. They just have different names. So ischiocavernosus and bulbospongiosus, male, female. And then there's more transverse perineal muscles. That exterior anal sphincters, super important, and central tendon of the perineum. So ischiocavernosus, spongy tissue here, allows a penile erection. Most animals, actually, do you know that most mammals, just for fun facts, have a literal bone in the penis to help maintain erection for the length of time it takes for animals to copulate, which for many animals is much longer than it takes for humans. And then the females have the bulbal spongiosis. And bulbal, there's also 2 glands that line the vagina that typically very much can become infected, and do very often in females. And they're bulbal something, and they can cause problems too. So that area I assumed was figured out by the same person. Superficial transverse perineal muscles, let's go back to, here's the deep transverse perineal muscles, much larger sheet of muscles than the superficial muscles here and here. And please note how they are connected to the pelvic bones to maintain integrity of the lower part of your body. The gluteus maximus is your butt muscle, and well, there's 3 of them. There's a maximus, a minimus, and then a medius. There's all 3, big, small, and middle. Then that anal sphincter, that external anal sphincter as well. So muscles you may have never considered in your life exist way down there. When do I have y'all till? 2:30? Okay. Completely different thing. That was the end of the axial muscles. We did skull, face, spine, thorax, abdomen, pelvis. So now we're going to move on to our appendicular muscles. Your shoulder. Your shoulder is the most loose joint in your body. It's the one you can move. You have the most freedom of movement. The thing that's holding the shoulder together is going to be the muscles and tendons, because remember, it's super easy to dislocate the muscle, because that's the price you pay for having that extreme of movement there. Most of our muscles are extrinsic. What is wrong with me today? They act in combination to a fixed shoulder girdle, mostly with the scapula, to increase range of motion. You can elevate, ha! You can depress, ha! You can rotate, whee! You can move laterally, you can move medially, you can protract. I have to remember what protraction means. Come on, EMTs, what is protraction? Oh, backwards, right? This? No? Or is that retraction? Nah, I'm confused. Oh, well. You can do lots of different things with your shoulder. Do you know what it is, Fatima?
What was the question?
Protraction and retraction. I'm sure you have learned this.
Retraction is this way, and then retraction is that way.
Okay, good. Thank you so much. Okay, in order to get this whole shoulder girdle going, you have anterior thorax and posterior thorax muscles. It makes sense, right? And here they are. We've already talked about the sternocleidomastoid, but it does come down and it actually, I did it wrong again. It originates from the sternum and the clavicle and goes up to the back of your neck. So it's down here forming some of the shoulder movement. Your deltoid, the big shoulder muscle. See men with their big old delts and they're like, I can't even move my arms because of my delts, you know. Okay, whatever. Pectoralis major is the chest muscle. Ladies and gentlemen, it's very important to have strong chest muscles to support the softer tissue above them. Sternum, that's bone. Biceps, look at that. It's so weak. I have no muscle, like it's there, but it's like it used to actually have there used to be a thing. Anyway. And then subclavius, or below the clavicle. Here's the clavicle. So here's well, you're just showing me the clavicle twice. I'm pretty sure they mean to be indicating this little muscle right here. Subscapularis is below the scapula. They're not trying to trick you. There is a pectoralis minor. There's a word I don't know, so I don't think you need to know it, but coracobrachialis. And then here's those serratus anteriors again that help line the ribs and they're part of the thorax. Wow, none of these are correctly where they're supposed to be. The humerus is not over here in your armpit. Here's your humerus. Ooh, fun, dead tissue. So here's a human being cut down for you to see these tissues in a human body. Let me go back if you weren't looking. Look at the drawing of these tissues and you'll see, I know it all looks the same on a human body, but you'll see actually how clearly defined they are. So here's that sternocleidomastoid again. Here's that delt, that triangular delt. Here is that pectoralis major. Ooh, external obliques, even funny. Ooh, rectus abdominis, yes. Here you can see they're kind of separated by these tendons here, but these are your serratus anteriors along the rib cage. Biceps brachii, subscapularis, there it is, pointed in the right correction. Look, once again, here's the drawing of the subscapularis. And then here it is in the human body. So that's the same. Pectoralis minor, and then internal intercostals just for fun. This is a fantastic photo. Wink, wink, wink. This is a fantastic photo. You might see it again, this fantastic photo. And they left some skin on just for fun. Cool. Oh, okay, sorry, I'm a nerd. All right, the back has all these muscles. Note, please, how ginormous the trapezius muscle is. Ladies and gentlemen, this is where, when you go get a massage and they're like, wow, you have a lot of knots. These are where your knots are. They're in this trapezius muscle. Typically right here along those occipital protuberances, down here, right where the sternocleidomastoid crosses over, here at this tendon area, and all the way down and around your scapula tends to be the most common places for muscle tension that needs to be released by massage. Also, you might have a lot of tension straight up and down your spine. This new era that we are in terms of stress, that's where my new tension is, right up against the spine. So yay. Okay, sorry, but look how large the trapezius is, okay? That's pretty important. Here's that delt again. Ooh, the latissimus dorsi, huge back muscle, as you can tell. Look, let me do something. No, not previous. Let's go back up to where we looked at back muscles before. Look at them. Look at all these tiny back muscles. Look at all these long, tiny back muscles. All right, and then let's go. Look at this giant back muscle. And see how it stretches over from the back and the spine over to the arm as well. Aids in arm movements, shoulder support, and back muscles. Back movement, sorry. Then you have the levator scapulae. Here is a supraspinatus on the back side, on the dorsal side. Ventral side had the infraspinatus. Yes, spinatus, sorry. And the backside has the supraspinatus. So above, wait, am I crazy? Yes, I am. Subclavius, I'm sorry, subclavius. Never mind, ignore everything I just said. But here's the supraspinatus, and then here is the infraspinatus here. And then teres minor and teres major. I don't know why the teres minor and teres major were always so important to my anatomy and physiology professors, but they showed up on every single, what do you call them? Lab practicals that I had. So I might as well continue the tradition, right? Yeah, I think so too. So know the teres minor and major here. It is a separate muscle from the infraspinatus. Let's see, what are those? Oh, and the rhomboids, minor being smaller, not, it would be supra-rhomboid, but it's the rhomboid minor because it's smaller, and then here's the rhomboid major. Underneath, well, that's really important too, I should say those words. The levator scapulae, rhomboid minor and rhomboid major, you can see are hiding underneath the trapezius on this side. And if you moved the deltoid out of the way, that's where you get the supraspinatus, the infraspinatus, and the teres minor and major as well. Let's see something. Let's see, 64. Arm movements, so many arm movements, and then all the tendons in the hand and wrist. 64, okay. 9 muscles cross the shoulder joint. Chink, insert and move the humerus. Some originate from the scapula, others from the axial skeleton. Actions include flexion, extension, and adduction. Your 3 prime movers. Here's something that's important for you to star. Prime movers, remember, do the majority of the work in moving the bone. Pectoralis major, chest, right? Latissimus dorsi, that big back muscle, and then the deltoid here. So you have one in the front, one on the side, and the big one in the back that are your prime movers for your arm, okay? Your rotator cuff, which kind of, it's below, oh, it's those. So it's below the trapezius and beneath the deltoid, your supraspinatus, your infraspinatus, teres minor, and your subscapulus. These act as synergists, so they increase the movement, and fixators. They originate on the scapula, reinforce the shoulder capsule and prevent dislocation. Thanks, guys. Then the corchiobrachialis and teres major are also synergists, so they help the prime movers move. All right, deltoid you got, pectoralis major you got, biceps brachii you've got. Now moving down, oops, moving down into the upper arm, behind the biceps, on the other side you have the triceps. It's what becomes, you know, the flabby arm fat you get as you age if you don't do working out things to make that not happen. Triceps has 3 heads, bicep has 2. Does that make sense? You got the lateral head, the long head, and the medial head. I'm not going to test you on those. And then you have the brachialis, which should be common sense to you where it is, because that's where we check the brachial pulse, right? It's up here actually, but the brachial pulse, and then the brachial radialis. So those are the muscles that are kind of right where you would be drawing blood if you were a phlebotomist as well. Important. The head's not so much, but triceps you should know has 3 heads, and biceps has 2. Move to the back where the triceps is. You can see 2 of the heads, the origin points of the triceps here. The third one is more on the front. Well, let's go back. Front side. Where's the medial head? Yeah, so it's kind of behind the biceps right there. And there's that teres minor and major again. Now look at the folding of how these muscles interact with each other. So the teres minor is superficial, let's do that, to the heads of the triceps, and the teres major is deep to the heads of the tricep there. There's that latissimus dorsi again. I'm not going to test you on this, but there's the anconeus that helps support the structure of the olecranon. This is a very, remember the whole reason that when you hit your elbow it hurts is that you actually have an area in between the bones that is not protecting the nerves. And that's why hitting the elbow is actually so sensitive, which means it's also a relatively loose joint as well. And so the anconus, you'll see, is connecting, what are we looking at? The radius and the humerus. I want to say that's the radius. Maybe I'm crazy. And here's more of the same, more of the same, more of the same. Always look, when you're studying, by the way, always pay special attention to the actual human anatomy that we have here. Like drawings are great, but try to look at it on the real human being tissue pictures that we have. Cool, I'm gonna stop there. I'm gonna stop there at 69, ha ha ha. Did a whole lot of pelvic floor talk and now we're stopping at number 69. Also, once again, I've been thinking about how to talk about sex all day long. So I think it's on my head. Anyway, do we have any questions about any of that? Once again, you don't really need me to be lecturing over this PowerPoint. You've pretty much proven you don't need me at all this semester, whatever. I'm really just doing this for funsies, so it feels like I'm doing a job, but you are welcome to learn the PowerPoint without having to listen to me. It's not gonna murder anything. They're already dead. Yes.
When are you leaving for maternity leave?
We, and by we, I mean myself, am hoping not until spring break. My due date is officially March 5th, but I'm hoping this little bugger waits another week.
So we have you next semester. That's
yes. Well, no. Remember, dual credit. Because I'm going on FMLA, you have to be switched over to somebody as of January, what, 7th? When do y'all come back? Whenever y'all come back. Because they have to be the teacher of record for the semester.
So when second semester comes around, we won't have you as a teacher?
No.
That's depressing.
Yes.
Tears are coming out.
Like, I cried in front of y'all. Y'all saw that. So, yeah. Also, don't get pregnant.
That's absolutely right.
Sorry, I really wasn't planning on it. I really
don't do this. Yeah. Anyway, no, let's enjoy the time we have together. Like your dual credit class ends in technically 4 weeks, so we're really done anyway. I mean, this is going to be your last practical. This is your last really important lecture exam because I'm going to go easy because the nervous system is just so huge in terms of content. It's going to be an easy test. And then your final. I somehow have to come up with like 5 more quizzes for you guys though. I have no idea what I'm going to do there. But yeah, so then we'll have a week to play. And then hopefully they listen to me and Miss Segovia takes over. Hopefully. Let's hope. If not, what's going to happen is you're going to be placed in a dual credit instructor's class, somebody on campus, but they're not going to be, I guess they would be more of a facilitator and you're really on your own. Which, once again, by the way, y'all been doing fantastic without me. Like, you don't need me this semester. I realize that. You can do it all on your own, but I don't like the idea of that personally. Okay. Apparently, I have to turn around and go teach biology now. Anybody want to do that for me?
You know that we're the best students here for biology.
I get paid.
Kathy, keep it to yourself.
Yeah, $28 an hour. There you go, Neon.
That's the best deal I've ever heard. I will do it. Give me the curriculum. I'll do it so fast.
I'll do it so fast.
We don't even need the curriculum. Just pull out your notebook from last
It's
year.
just like biology.
I will do it. I will do it for you. Matter of fact, make that 35. No, I'm telling you, it's the best deal I've ever heard so far.
You can get paid more than I do an hour. That would not work.
I'm saving up for college. I think they'll make an exception. Money at the moment. Currently,
If you
broke.
become a teacher and you teach for 5 years, then the rest of your student loans are waived. You have to apply for it, but
I will become a math teacher. That's all you have to say. I'm going to become a math teacher. Yeah, I suck at every other subject.
you did not suck in world health research. And
Well, because
were you in my biology class? Why don't I remember this? Obviously, you had to.
You don't remember?
Okay,
It's
Whatever.
okay. I'm not-
whatever. It's been a Monday. God, has it been a Monday? I hope y'all don't mind, by the way, that we haven't done any kind of grading thing for like 2 weeks. I hope y'all were cool with your grades by then, because we had 7 assignments and I was like, I'm done with you guys. So, yeah. All right, get out of here. I got to end this so I can open up for biology.
Bye, Miss
Bye, Miss
Moore.
Moore.
Bye.
Miss Moore.
See ya. Bye,
Bye,
Thomas.
Miss.
Bye, Lena. Bye, Pedro. Bye, Niat. Bye. Bye, all of you.